Today we are going to talk about bone marrow transplant. Bone marrow transplant is the curative treatment for blood cancer. Two types. Auto means self. I take the blood sample from the vein, from myself, process in the lab and put it back inside. Total days 14 to 21 days. What are the indications in adults? Multiple myeloma. Every multiple myeloma should get a bone marrow transplant. This is a message to my friends from Fortis Institute of Blood Disorder to the world that up to 70 years of age, every multiple myeloma, the most affordable way you can live longer, up to 65 to 70 months. Autologous transplant. Autologous transplant, not to be afraid, 99% success. Second indication is lymphoma. Any lymphoma which is relapsed. T-cell lymphoma upfront. DLBCL who has got double hit or triple hit upfront. Do transplant. So that's an autologous transplant. And did you know that autologous transplant is also available for multiple sclerosis and systemic sclerosis, autoimmune disorders? Today we can cure autoimmune disorders where there is no cure. So whosoever is listening to me from the world, please realize that multiple sclerosis, debilitating disorder, is getting cured at Fortis Institute of Blood Disorder. Systemic sclerosis, SLE, Crohn's disease, dermatomyositis, these can be cured. That's autologous transplant. If we talk about allogeneic transplant is of three types. When I do it for my brother, the chance of matching in HLA is 30%. So no blood group. Special type of genetic testing called HLA testing. So if my real brother, 30% chance for a match. If I don't get a match, then what do? I search in the worldwide registry, which is called MUD. Match Unrelated Donor Transplant. MUD. MUD. So once you have your HLA, which is called high resolution HLA, you send it to me through him, through the numbers given below. You send it to us, we will search within 48 hours whether you have a donor or not. If there is no donor, then there is half match. That's from your brother, sister, mother, father, kids also. Half match is now as good as full. Half match is as good as full. Means 80% chance of success. So, not to be afraid, bone marrow transplant is not the last option, it's the first option. It's not a surgery, it's a plain simple blood transfusion. And what you require is an HLA, high resolution HLA. High resolution HLA. A simple blood test which matches between the brother sister. So, need not worry. Blood cancers can be cured by autologous and allogeneic bone marrow transplant.